Alright, looking at the pancreas, one of your larger endocrine glands. The pancreas secretes hormones. It's considered an endocrine gland. It also will produce digestive juices, so it's considered part of your digestive system when we talk about the digestive system. So that would be an exocrine gland. So your pancreas is part of your endocrine system and your digestive system. So if I look at your pancreas, here's the shape of it. There's a duct, pancreatic duct, that runs through the center of it. Notice the bile duct that's going to come from your gallbladder empties right next to your pancreatic duct. And they are both going to secrete into your small intestine. So they will be important for digestion.
Sorry, I just need to grab one of these buttons.
Okay, so structure, like I said, it's elongated. It's one of your larger endocrine glands. It's close to the stomach. The endocrine part of the pancreatic islets, called islets of Langerhans.
Langerhans.
Yep. Include two types of cells. Alpha cells secrete glucagon, and beta cells secrete insulin. That you should probably know. So alpha glucagon, beta insulin. And then a duct that I just pointed out joins the pancreas to the duodenum, which is the top part of your small intestine, and that's where the digestive juices are going to enter your small intestine. Here's just a microscopic view, shows one of the islets, or the islet of Langerhans. So here's the job. Glucagon. Alpha cells. Glucagon increases your glucose levels in the blood. So glucagon increases the blood levels of glucose by breaking down glycogen and converting non-carbohydrates into glucose by the liver. So glycogen is a larger form. It's going to be broken down into glucose, and then it also takes some non-carbohydrates and puts them into glucose. The release of glucagon is controlled by negative feedback, pretty much like most of your endocrine system. So it measures the levels of glucose in your blood. So glucagon increases blood level, or sugar levels, glucose levels in your blood. Insulin has the opposite effect. Insulin decreases the blood levels of glucose. So it's going to stimulate the liver to form more glycogen, which is that larger chemical. Promotes diffusion of glucose into cells so that it leaves your bloodstreams, increases protein synthesis, and stimulates adipose cells to store fat. So insulin is going to cause your body to absorb more glucose, so it gets out of your bloodstream. After a big meal, you have lots of sugar in your blood. That sugar that's in your blood needs to get to your cells and out of your blood. Insulin helps to do that. Here again, same system. It's going to be controlled by the negative feedback system, and it's going to look at the amount of blood glucose in your, or the amount of glucose in your blood. Too much glucose in your blood, insulin's produced. Too little glucose in your blood, glucagon is produced. So insulin and glucagon coordinate to keep your blood glucose at a normal range. So they work opposite of each other to keep the levels of your blood where they should be. So here I have a normal blood glucose concentration, and that's a fairly wide range. If I have too much glucose in my blood, it's going to stimulate beta cells, which produce insulin. Insulin's going to cause glucose to be absorbed by cells, gets it out of your blood. It's going to take that glucose, put it together to make a larger molecule. My blood glucose should go back to normal. If it's too low, you hear of people who have low blood sugars. If it's too low, then my alpha cells are going to be stimulated to produce glucagon. Glucagon is produced, opposite things happen. Glycogen is now broken down into glucose, glucose goes into the blood, and liver cells also make glucose from non-carbohydrates. So alpha cells make glucagon, beta cells make insulin. Insulin lowers your sugar level. Glucagon raises your sugar level. So diabetes, very, very common endocrine disorder. Metabolic disease due to lack of insulin, or for some reason the inability for your insulin to be used. Type 1 diabetes is an autoimmune disorder. Your beta cells are basically non-functioning. Beta cells are destroyed. Type 2 diabetes is when insulin is produced, but it's not recognized by the cells. Typically, type 1 diabetes affects younger people. Type 2 diabetes is sometimes called adult onset diabetes. And a lot of times, your insulin is still produced, but your cells may have been, I don't know if overused is the right word, but we pick on my dad. My dad has mild diabetes, but we always tease him that it's self-induced because he has not regulated what he has eaten ever in his lifetime. And that's why, as people get older, they can develop diabetes. If you have type 1 diabetes as a young child, that is where your beta cells are not working properly and you're not making insulin. Some people will have a little insulin pump. Some have to give themselves shots. There's different things they can do with that. So symptoms, basically it's going to deal with the amounts of glucose in your blood. So hyperglycemia, I have too much sugar. I can also be hypoglycemic and have not enough sugar. Acidosis, how much acid. Your polydipsia and polyphagia, deal with polysaccharides and types of sugars there. And I think I'll keep going. So here we are with the pineal gland, very, very small gland, near the upper portion of the thalamus. It does secrete melatonin, which is a relaxing hormone, involved with the regulation of circadian rhythms of the body. So circadian rhythms can help with like your sleep patterns and things like that. So melatonin is released in higher doses at night. It may also help to regulate female reproductive cycles, both male and female. It might peak some during puberty. And if you look at teenagers and their amount of sleep that they need and want, can deal with the amount of melatonin that their body is producing.
So we get to sleep all the time because it's good for us?
Well, teenagers actually do typically require more sleep, yes. Studies have shown that teenagers would do better if we started school later in the day. because of their sleep habits. Hasn't changed that much, but they've done a lot of studies
We need to
on
do
that.
that and get out at like 30,
Yeah.
3:45.
The sad part about it is teenagers need more sleep, but a lot of them don't get more. So a lot of you stay up too late and then you do get up.
2
So
o'clock in the morning.
thymus is between your lungs and sternum, so kind of in your chest, secretes thymosins, and they are going to affect T lymphocytes, very important for your immune system. So T lymphocytes, like I said, important to immunity. And this gland is the largest in children and shrinks with age. So think about, as a child, you are introduced to the flu, you're exposed to strep throat, you're exposed to so many things as a young child. Your immunity is built up mostly at a younger age. And then that immunity should carry on into adult. But once you get into, and this is even older than I am, as you get older, then that immunity kind of starts to shrink back down again. Which is why when they talk about flu and deaths from the flu, people that die the most are usually very young children and older adults because their immunity is not as strong. So that should kind of make sense. Reproductive glands, ovaries in the females are going to produce estrogen and progesterone. Biology, you should have probably talked about that some. The placenta, when a woman is pregnant, the placenta produces estrogen, progesterone, gonadotropin.
I don't remember that one.
Gonadotropin?
Yeah.
And it is specifically just when a woman is pregnant. Yep. So there are hormones, which is why when you take a pregnancy test, the positive, negative, there are hormones that are only produced when a woman is pregnant. Testes, their main hormone is testosterone. Digestive glands, and this would include your pancreas. Digestive glands do secrete hormones that help with digestion. Your heart actually secretes ANP, atrial natriuretic peptide, and that helps to regulate sodium in water also. Kidneys secrete erythropoietin, and that is very important for blood cell formation. And we'll talk about that next semester more when we talk about red blood cells. So erythropoietin is very important for producing new blood cells. I'll stop, I suppose. Stress and health. This one becomes important to everybody.